Okay, for your nasogastric checkoff, you're going to need a couple of items. You're going to need a pair of gloves. You will need your Salem sump, your KY jelly. You'll need a cup with a straw, tape to secure your nasogastric tube, your syringe here, eyewear, protective eyewear, an emesis basin, and on the emesis basin I've got your nitro test there where you can test the acidity, and then a drape to put over them. Okay, the first thing that you're going to do is prepare your patient. So we're going to sit them high and upright in high Fowlers, and we're going to place the towel across their chest. All right, at this point, we're going to don clean gloves and put on our safety glasses. All right, and the next part is we're going to assess their nostrils to assure patency. And one way that you can do that is to occlude one nostril and get them to take in a breath of air through the other. Just to see, okay? All right, after that we're going to use the tube to measure, and we do the NEX method, which is nose to earlobe to xiphoid process. Nose to earlobe to xiphoid process. All right, once you find that measurement, you're going to tape it to give you a clue where to stop once you're advancing it. You might be able to identify it with the black marks that are on the tube, but not everybody's going to line up on a black mark. All right, this is a non-sterile procedure, so you can use your clean gloves. All right, once you get your tube there and get your measurement, you're going to lubricate the tip of your tube with a water-soluble solution. So you'll use your KY jelly. You can squirt that onto your packaging of your nasogastric tube to be able to dip it in. All right, at this point, I would go ahead and take my tube and put my syringe on the end of it. And that's just going to be there. You're going to have, at the end, you're going to inject air. So you're going to need it filled with maybe 10 milliliters of air on the end. And this is just having it in position so that once you get down, you can inject the air, auscultate, and be able to move forward. All right, so now your patient's ready for the tube. So you're going to educate them about the tube. I would take the pillow out. All right, at the very beginning, you need him to hyperextend his neck. You're going to insert the tube until it reaches the back of his throat. He might gag just a little bit. All right, once he gets to the back of the throat, you're going to flex his head forward. All right, once he flexes his head forward, you're going to insert it slowly, but what's going to better benefit is to have the cup and get him to drink, and as he swallows, you can advance the tube. So swallow, swallow, and swallow. All right, one thing is to remember on these mannequins, they're not like real people, so if you flex it too tight like this, it's not going to advance. So I want you to go through the process of saying, I flex it, and maybe just relax his head back after you've gone through that process. Him being relaxed is going to help the tube advance a little bit further. All right, so once you feel like you're in place, once the tube reaches where it needs to go, you're going to be able to tape the nostril and confirm your placement. So at this point, you want to make sure you secure it. Some people will go ahead and check placement here, but it might slide out. So maybe just a small tape would be good. So go ahead and prepare. And we might just wrap one pants leg around. All right, once you get it to where that tape is, you want to remove the tape that was supposed to be your measurement so that you can tape around it. All right, so you're just going to secure it. I would just secure it with one until you get true confirmation. All right, so now you're at the point that you can put on your stethoscope. And you're going to inject about 10 milliliters of air and auscultate over the stomach region. And you should hear a swoosh sound. Swoosh. All right, so you hear the swoosh sound, you know that you're there. Another way to confirm placement would be to aspirate the gastric content. Aspirate the gastric content. All right, and take that out, and you're going to need to occlude your tube. You can squirt that into your emesis basin and take the nitra test and test. And your pH value should be between 1 and 3.5. All right, that's another way to confirm. The most definitive way would be by x-ray. You can also ask your patient to speak or hum. They wouldn't be able to speak or hum if it's in the lungs. Make sure you observe your patient for any coughing, gagging, choking, or cyanosis, because that might indicate that it's in the lungs as well. If you feel like it is in the lungs, your patient is not doing well, you would remove and start over once they have recovered. So at this point, you're going to secure the tube to the patient's nose. I want to make sure you pinch around the very tip of it. That way it'll secure that tape around that tube. And now you have to secure it to their gown. Remember to give enough leeway in the tube so that they can turn their head from side to side. So you'll tab your tube and you will place a safety pin, which is over there by your basin. And you want to make sure that with the Salem sump, the blue pigtail is above the stomach. If it's below the stomach by gravity, it can leak gastric contents through the blue pigtail, which is important not to occur. If you have to hook your patient up to suction, you will leave the connector on the blue pigtail. And you will leave the connector on the end of the tube, and you will connect the suction tubing to that and turn on your suction. In order to pump the stomach.